Skilled nursing facility care is covered in full for the first 20 days when you meet the requirements for a Medicare covered stay. In 2017, under original Medicare, days 21 to 100 of skilled nursing facility care are covered for each benefit period except for coinsurance of up to $164.50 per day. After 100 days, Medicare Part A no longer covers skilled nursing facility care. You can qualify for skilled nursing facility care again every time you have a new benefit period and meet the other criteria. Let's move on. To be eligible for home health care services, you must meet all of these conditions, and that's very important. Number one, you must be homebound. An individual shall be considered confined to the home or homebound if the following two criteria are met. One, the patient must be either because of illness or injury need the aid of supportive devices such as crutches, canes, wheelchairs, and walkers, the use of special transportation, or the assistance of another person to leave their place of residence. Or, number two, have a condition such that leaving his or her home is medically contraindicated. If the patient meets only one of the two previous conditions, then the patient must also meet these two additional requirements. There must exist a normal inability to leave home, and leaving home must require a considerable and taxing effort. Next one is you must need skilled care on an intermittent basis, or physical therapy, or speech language pathology, or have a continuing need for occupational therapy. Next one, your doctor must decide that you need skilled care in your home and must make a plan for your care at home. And next, number 4, prior to certifying your eligibility for the Medicare home health benefit, the doctor must document that the doctor or a non-doctor practitioner has had a face-to-face encounter with you. The encounter must be done up to 90 days prior or within 30 days after the start of care. The law allows the face-to-face encounter to occur via telehealth in rural areas in an approved originating site. This means medical or other health services given to a patient using a communication system like a computer, phone, or a television by a practitioner in a location different from the patient's. And the last one, the home health agency caring for you must be approved by Medicare. Just want to make a note here as well. Part B also may pay for home health care under certain conditions. For instance, Part B pays for home health care if an inpatient hospital stay doesn't precede the need for home health care, or when the number of Part A covered home health care visits exceeds 100 days. Okay? In original Medicare for Part A, covered home health care, you pay nothing for covered home health care services provided by a Medicare-approved home health agency. Durable and medical equipment, when ordered by a doctor, is paid separately by Medicare. This equipment must meet certain criteria to be covered. Medicare usually pays 80% of the Medicare-approved amount for certain pieces of medical equipment such as wheelchair or walker. If your home health agency doesn't supply durable medical equipment directly, the home health agency staff will usually arrange for a home equipment supplier to bring the items you need to your home. Also, I want to make a note on this one. Part A covers post-institutional home health services furnished during a home health spell of illness for up to 100 visits. After you exhaust 100 visits of Part A post-institutional home health services, Part B covers the balance of the home health spell of illness. The 100 visit limit doesn't apply to you if you are only enrolled in Part A. If you are enrolled only in Part B and qualify for the Medicare home health benefit, then all of your home health services are paid for under Part B. There is no 100 visit limit under Part B. Part A also covers hospice care, which is a special way of caring for people who are terminally ill and their families. Hospice care is meant to help you make the most of the last months of life by giving you comfort and relief from pain. It involves a team that addresses your medical, physical, social, emotional, and spiritual needs. The goal of hospice is to care for you and your family, not to cure your illness. Okay, so let's move on. Okay, so here I also want to add you must sign an election statement choosing hospice care instead of a routine Medicare covered benefits to treat your terminal illness. However, medical services are not related to your hospice condition would still be covered by Medicare. You can get hospice care as long as your doctor certifies that you are terminally ill and probably have less than 6 months to live if the illness runs its normal course. Care is given in election periods, 90-day periods followed by unlimited 60-day periods. At the start of each benefit period, your doctor must certify that you are terminally ill for you to continue getting hospice care. Medicare also requires face-to-face visits. The doctor is required to meet with you within 30 days of hospice recertification, starting before the third election period and each subsequent recertification. The hospice provider must be Medicare approved. In addition to regular Medicare covered services such as doctor and nursing care, physical and occupational therapy, and speech language therapy, the hospice benefit also covers medical equipment such as wheelchair or walkers, medical supplies, for example, bandages and catheters, drug for symptom control and pain relief, short-term care in the hospital, hospice, inpatient facility, or skilled nursing facility when needed for pain and symptom management. Inpatient respite care, which is care given to you by another caregiver, so usual caregiver can rest. You'll be cared for in a Medicare-approved facility such as a hospice, inpatient facility, hospital, or nursing home. You can stay up to 5 days each time you get respite care, and there is no limit to the number of times you can get respite care. Hospice care is usually given in your home or a facility you live in. However, Medicare also covers short-term hospital care where needed. Next one is hospice aid and homemaker services, social worker services, other covered services, as well as services Medicare usually doesn't cover, like spiritual and grief counseling, dietary and other counseling. All right, let's move on. For hospice care in original Medicare, you pay a co-payment of no more than $5 for each prescription drug and other similar products for pain relief and symptom control while receiving routine or continuous care at home, and 5% of the Medicare-approved payment amount for inpatient respite care. For example, if Medicare has approved a charge of $150 per day for inpatient respite care, you'll pay $7.50 per day. The amount you pay for respite care can change each year. Room and board are only payable by Medicare in certain cases. Room and board are covered during short-term inpatient stays for pain and symptom management and for respite care. Room and board aren't covered if you receive general hospice services while a resident of a nursing home or a hospice residential facility. However, if you have Medicaid as well as Medicare and reside in a nursing facility, room and board are covered by Medicaid, or in California, it's Medi-Cal. Okay. Medicare Part B medical insurance helps cover medically necessary outpatient services and supplies. Doctor services, services that are medically necessary, outpatient medical and surgical services, and supplies for approved procedures like X-ray or stitches, clinical laboratory services, blood tests, or urine analysis, and some screening tests. Durable medical equipment like walkers and wheelchairs. You may need to use certain suppliers under the durable medical equipment, prosthetics, orthotics, and supplies competitive bidding program. Diabetic testing supplies. You may need to use specific suppliers for some types of diabetic testing supplies. Preventative services, exam, tests, screening, and shots to prevent, find, or manage a medical problem. Medicare Part B covers a variety of medically necessary outpatient services and supplies. Certain requirements must be met. So let's go over. Doctor services. Medicare covers medically necessary doctor services, including outpatient and some doctor services you get when you're hospital inpatient, and covered preventative services. Medicare also covers services provided by other healthcare providers like physician assistants, nurse practitioners, social workers, physical therapists, and psychologists, except for certain preventative services for which you may pay basically nothing. You pay 20% of the Medicare approved amount, and the Part B deductible applies. Outpatient medical and surgical services and supplies. Medicare covers approved procedures like x-rays, casts, or stitches. You pay 20% of the Medicare approved amount for the doctors or other healthcare provider services. You generally pay the hospital a copayment for each service you get in a hospital outpatient setting. The Part B deductible applies here. Durable medical equipment. Medicare covers items like oxygen equipment and supplies, wheelchairs, walkers, and hospital beds ordered by a doctor or other healthcare provider enrolled in Medicare for use in the home. Some items must be rented. You pay 20% of the Medicare approved amount, and the Part B deductible applies. In all areas of the country, you must get your covered equipment or supplies and replacement or repair services from Medicare approved supplier for Medicare to pay. Medicare has a program called competitive bidding to help save you and Medicare money, ensure that you continue to get quality equipment, supplies, and services, and help limit fraud and abuse. In some areas of the country, if you need certain items, you must use specific suppliers, or Medicare won't pay for the item and you'll likely pay the full price. This includes mail order diabetic self-testing supplies, insulin pumps, and pump supplies. The Centers for Medicare and Medicaid Services, or CMS, is required by law to recompete contracts under the durable medical equipment, prosthetics, orthotics, and supplies. Competitive bidding program at least once every 3 years. The Round 2 and National Mail Order Program contract period expires on June 30, 2016. Well, expired already. Round 2 recompete and National Mail Order recompete contracts are scheduled to become effective July 1st, 2016, and will basically expire on December 31st, 2018. Okay. Home health services. Medicare covers medically necessary part-time or intermittent skilled nursing care and or physical therapy, speech-language pathology services, and or services for people with a continuing need for occupational therapy. A doctor enrolled in Medicare or certain healthcare providers who work with the doctor must see you face-to-face before the doctor can certify that you need home health services. The doctor must order your care, and a Medicare certified home health agency must provide it. Home health services may also include medical social services, part-time or intermittent home health aid services, durable medical equipment, and medical supplies for use at home. You must be homebound as defined previously. You pay nothing for covered home health services. Other including but not limited to medically necessary clinical laboratory services, diabetes supplies, kidney dialysis services and supplies, mental health care, limited prescription drugs, diagnostic x-rays, MRIs, CT scans, AKGs, transplants, and other services are covered, but costs may vary. Just want to make a note here. Part A covers post-institutional home health services furnished during a home health spell of illness for up to 100 visits. After you exhaust 100 visits of Part A post-institutional home health services, Part